So this talk is going to be recorded today, so I have to stand somewhat near the mic, I guess, and I can see my image up there. This is a little bit nerve-wracking of a format. So I'm so excited to have the opportunity to talk to you today and the opportunity to talk about this topic. This is actually a little bit of a departure for me because most of my experience has been in dating violence and issues of teen violence and substance use, even prior to that. And this represents less of work I've completed and more work that I would like to do. And as I've kind of gained literacy in this area over the past really couple months, if there are some tiny gaps, if there's a question I can't answer, please forgive me because I'm just diving into the literature. But please, I invite questions at any time. This can be very conversational. I'm happy with that. So I first want to start with a slide about the biological plausibility that, in fact, using marijuana could affect driving ability. There's been a lot of research on the effect of marijuana on the brain and how it affects perception and short-term memory and attention and reaction time. And to people in this room, we could probably infer that would have an impact on driving. But there actually hasn't been a lot of research on what that looks like. What does that actually mean behind the wheel? Some studies have been done in simulators, mostly a little bit of on-road driving research, but mostly it's simulator research where they put an actual car in a room, and then they set up screens at 180 degrees around the car and essentially have an advanced video game, and this is how they study these things. And what they found is that people under the influence of marijuana, there's some variability in speed and lane position and following distance. There is a longer time to pass a car, worse performance when there's any kind of divided attention or multitasking required, and there's some issue of visual field, so looking for hazards. So these are the mechanisms in which we can imagine marijuana could lead to worse crash outcomes. There's also some evidence, which is intriguing, about compensation. So there seems to be some awareness among those who are impaired that they are impaired, and so they attempt to compensate. And so there's some evidence that they drive at slower speeds and more cautiously. But this is limited. There are circumstances when there's unexpected events, and because of that decreased reaction time, because of those issues of attention, this compensation doesn't hold up under difficult circumstances. And these are the circumstances in which we think car crashes occur. And it's also difficult to maintain concentration over long periods of time. And I think this is interesting because just in reading popular literature and things, you might hear this reaction from certain segments of chronic users that, oh, I drive better under the influence of marijuana or on long road trips. And I would say that there's some kind of contradictions for that. There's also this issue of tolerance, and this is a much bigger issue with marijuana than with alcohol. There's much more individual difference in the dose needed to produce effects on an individual, and there's not this clean relationship between the levels in the blood and the levels in the brain and the levels in the brain and the physiological effects that you get with alcohol. So that makes this field or studying marijuana impairment to be much more difficult. And there's actually some indication that marijuana could be present in the brain when it's not present in the blood. So the metabolism is different. And this is where this is not my area because I have pretty limited exposure to chemistry. But this is what I've read. And also users can develop tolerance. And tolerance develops for different aspects of the drug. So there's some tolerance for memory impairment, but not necessarily tolerance to feeling high, which is why it's used recreationally. And there's also limited tolerance to motor impairment. So it's important to know what the tolerance is being developed for what aspect of the drug, what impact of the drug. And so basically some new research that's coming out is suggesting that basically if there's active metabolites in the blood, that means there's active detectable impairment. And also that if there's chronic use, there's chronic impairment, which may or may not be reversible. Research is still trying to tease apart the extent to which really heavy use over a long period of time leads to irreversible changes, and to what extent abstinence for a long period of time, in which it can all be released from the fat metabolized, to what extent that can be reversible. Any questions so far? I don't know if I'm going too fast here. Okay, so the $1 million question is, does this lead to crash risk? Or at least I would say this is the $1 million question. And there's some growing evidence from observational epi studies that yes. And we have kind of limited and flawed data to look at this, but there's some growing consensus around this. And there's also some suggestion of dose response, which I think we would not be surprised to see, that a higher dose would lead to greater risk. And the really big issue, which just colors all this research, is there is a lot of poly-drug use with alcohol, and that makes it hard to study the individual effect of anything. And the problem is a little bit of marijuana with a little bit of alcohol is maybe worse than a moderate amount of marijuana. So at least additive effects. Some are suggesting more than additive effects. So I just want to highlight some of these systematic reviews. I think the best is the Asbridge study out of Canada. He did a systematic review of crash studies, and he limited his review to those who had assessed marijuana in the blood, and they looked for the active metabolite. And he found an odds ratio increased crash risk of about 2. And here's a figure from his study where he looked at subgroups of studies. So it looked like case control studies had a higher risk estimate than culpability studies. And for those of you who aren't familiar, this is a study design that's used a lot in transportation research with this sort of data, where you have a hard time identifying controls. You know the case, it's the person who was in the car that was at fault in the crash. So what they do is they take the person who was identified not as fault, and they call that person the control, and assume they had equal exposure, driving exposure. And there's some bias, as you would imagine. People who are deemed not at fault maybe are not at the same risk of getting in a crash as just anyone driving on the street. So, but it's used a lot as a study design. High quality studies had a higher estimate of risk than medium quality, and fatal collisions had a higher estimate of risk than non-fatal property damage or non-fatal injury. Another meta-analysis that's received some attention came out in 2012. They didn't limit their study to just those who had looked at active metabolites, but they found about the same odds ratio, and it's just a figure from their study. You can see the estimates are all, except for one, above 1.0. And then another study that's received some attention looked at a bunch of different drugs. I think it was like maybe more than 12 categories of drugs. And they looked at these in a lot of different ways. They looked at the method of assessment, like blood, urine, oral fluids, the severity of the accident, and they adjusted for publication bias. And so they have a range of estimates they present, not all of which are significant for marijuana. And again, they did not limit their studies to just those looking at active metabolites. And they don't have a lot of detail because they look at so many different drugs. So that's why I'm just glossing over that quickly. I'm interested in adolescents. I'm interested in young drivers, novice drivers. And this is an important population because it seems that they're even greater risk than adult drivers. And it appears that this is due to inexperience. I mean, young drivers overall have a very high crash risk. If you look at the plot, it starts out about here at 16 and then just plummets even into the early 20s. So very quickly there are declines in crash risk with age. So you'd expect a higher crash risk among young drivers. But when combined with alcohol, there's evidence of an interaction effect beyond that you'd expect from inexperience. And I think the same might be true for marijuana, but this is an open question, something that I'm interested in pursuing. So now I want to talk about, well, what is the potential scope of this problem? So after alcohol, marijuana is the most commonly detected drug among drivers, and it's also widely reported as a relatively prevalent drug of use. Looking at the National Survey of Drug Use and Health, about 4% reported driving under the influence of drugs in the past year. And the National Roadside Survey, in which they actually stop drivers and say, if you participate in the study, we won't prosecute you. In fact, we'll help you get home safely. And they do this about every 10 years or so with a random sampling of about 300 locations across the country. They found that 16% of drivers during a high-risk time period, so weekend nights, tested positive for drugs. And of those, or of all, 9% tested positive for marijuana. The level is not available. And at the same time period, for a blood alcohol level of above 0.08 was 2.2%. And the next time, by the way, this is from 2007, the next time this will be administered is in 2015. And so we hope that the data there'll be a lot more attention to this issue and a lot more clarity about the level. Monitoring the Future has asked teens about self-reported impaired driving behaviors, and they found about 12% of seniors reported driving under the influence of marijuana the past 2 weeks. And since 2001, this is mapped on basically to the prevalence of use. So that makes sense. As use goes up, reported self-reported impaired driving has gone up and down. YRBS has asked about alcohol impaired driving, and numbers are around the same. About 8% of high school students report alcohol impaired driving in the past month. And for teens, this is a little bit of a departure, but for teens who don't drive or don't drive all the time, there's also an exposure to riding with an impaired driver. And about a quarter of high school students have done that in the past month. I was involved in a study at NICHD that was a nationally representative cohort starting in 10th grade. And from that study, we had 2 papers and found about the same thing as YRBS. About 12% of students have drove impaired. We didn't separate out alcohol or drugs because this is just so new. I think we didn't know when we designed our survey that would have been a good idea. But about 12% drove impaired in some way in the past month, and about a quarter rode with an impaired driver in the past year. And we also found that Hispanic teens were at a greater risk of riding with an impaired driver. I'm going to come back to this in a second. Here in Colorado, the local YRBS did separate out the questions and found about the same thing. About 1 in 10 teens have drove after using marijuana in the past month, and about a quarter have ridden with an impaired driver. And I have the numbers here for alcohol. In this issue of potential disparities in risk, I highlight here a figure from CDPHE, the Colorado Department of Public Health and Environment's 10 winnable battles, and they also identified this issue of Hispanic and Latino teens being at higher risk of riding with an impaired driver, and they identify this as a winnable battle. And I just think it's, for all teens, not just Latino teens, we really don't know much about this risk. I mean, I think we might imagine that these are peers, but we really don't know. And looking at the issue of potentially adults exposing these teens to this risk, I think is something to look into. Who actually is the driver in these circumstances? This figure is from a study that just came out this year, got a lot of press. This is looking at trends in marijuana-impaired driving since 1999. And this is using the FARS data set, which is the Fatality Analysis Reporting System. And so every state collects data on fatal accidents. This is supposed to be a census of all fatal accidents. And then they report that, and it turns into a national data set that's available for use. But this data set does not distinguish the level of marijuana in the blood or if it's an active or inactive metabolite. And so there's this really, and the authors say this in the limitation, this really represents prevalence in drug use among drivers. But I think we can imagine it tells us something about actual impairment. But it's not specifically a measure of impairment, it's a measure of drug use. But the box that or the line that has the arrow is the prevalence of marijuana. So drivers who died within an hour of a crash who had a drug test, the percent that tested positive for marijuana. So as you can see, it's increased. The rest are other drugs. Let's see, depressants, narcotics, stimulants. Those are the other lines. They're relatively stable, and marijuana is increasing. Yeah.
Why do they have any idea why it went up after 2003? Is it a difference in measurement, or am I leaving it to your next slide?
You're not, and I am not sure. I'll have to read the article more closely, see if they identify that jump, or if maybe that's just fluctuation. I'm not sure. Yeah, it's a good question. Yeah, so this analysis is 6 states, and I remember California is one of them, but I don't remember the other states, so that might have something to do with it. because they only looked at states that do a really good job of blood testing fatal accidents, and I don't know if Colorado is one of those. So they limited their study to states that test more than like 80 or 90% of drivers who die within an hour of a crash. So that was only 6 states. So I'll look and see what those are, and that could have something to do with laws in those states.
What's the trend that's going down?
That's the triangle, and that is stimulants. So this next figure is the same study, but this is just looking at cannabis, and this is by age group. And the top line is less than 25 years old, and each line is an older age group. So the next line is 25 to 44, 45 to 64, and then 65 years old. So again, young drivers, we're worried about them. Here's some data, local data from Colorado about positive drug tests. So when they have done drug tests, just the absolute number that are testing positive, and THC appears to be on the rise. I don't think there's been any specific analysis of these data. And then this is from the Colorado Department of Transportation, the number of fatalities in the state since 2006, the number of drivers involved, how many of those drivers were tested, and this is either because of protocols about fatalities or suspicion. So not in every case. I think it's pretty much the prerogative of the law enforcement officer to decide that. And then the percent who are testing positive for any drug at any level, and the percent who are testing positive just for marijuana. And so again, there hasn't been any specific analysis of this data, but to me, I mean, there might be some indication here of an upward trend in those testing positive for marijuana only.
And is this random testing, or is this in the course of another violation, or?
Yeah, this would not be random testing. This would be a fatal accident, and I mean, the recommendation from the federal government is that all fatal accidents drivers are tested, but that's not necessarily the case. And I don't know exactly what circumstances in which you do that, and I think it's probably based on whatever circumstances of the crash.
Just a quick question.
Yeah.
So they're testing the dead drivers?
That's my understanding.
Not my ears.
Yeah, it's
They're
There's
testing.
different kinds of drug testing too. There's the 5, which is the basis of the Department of Transportation drug testing, but that doesn't test for all drugs.
That's right. Yeah.
Is this all drugs? Is that the 5, or is that all drugs?
All drugs that they tested for. So I don't know. And there are apparently 2. There used to be 3 labs in the state who do this testing, and I'm not sure exactly what their protocols are and if they're the same to one another. Was there another question? Yeah, the drug panel, whatever it is that they give. So it could be prescription drugs, for example.
Well, and just to follow on Judy's question, I'm assuming it's drivers in fatal crashes, but it's not always the driver who dies.
That's right. Yeah, right. So a passenger could be the fatality, and then there could be 2 drivers involved, neither of which passed away. Yeah. And just to compare this, and this is not a direct comparison, but just an indication of what alcohol-impaired driving looks like in the state. This is the data that Colorado sent to the national FARS data set about fatalities involving a driver with a blood alcohol level of above 0.08. And this is just to show you that it's approximately stable. And just going back to, I should have mentioned that in this study, this figure did not include alcohol, but I think it was about 39% over time, roughly stable. Fatal car crashes involve someone with a blood alcohol level of 0.08. And that's stable line for alcohols in comparison to these drugs. Okay. So this is just to highlight some of the data limitations in our country right now. The FARS data set does not record the level of the drug, unlike alcohol. Time since intake can be extremely variable, up to a couple hours. Not all drivers are tested. Not all fatally injured drivers are tested. And this varies by state, with some states testing 0 to more than 80 or even 90%. And roadside testing, both for research and for law enforcement is extremely complicated. And I really sympathize with the challenges for law enforcement of what to measure in what body fluid, the time since consumption, the different modes of consumption, differences in metabolism, differences in dose on impairment by individual, and then this issue of polydrug use. I mean, it's almost big challenges to this area. I can see why there's a lot of debate. And this brings to the slide about legal limits, which I think is probably the other $1 million question in the state right now. And I think we kind of default to this comparison to alcohol and, you know, our blood alcohol limit at 0.08. But it turns out there's just limitations to how far you can take those parallels. Some states have what are called per se laws. And maybe this language is familiar to all of you, but I just moved here. And so I'm just dialing into this debate. But with the per se law, which is what our blood alcohol laws are, the driver's assumed impaired if they're at that level. And so a lot of states have zero tolerance per se laws for drugs. So if you can detect it, that's the limit, and you're impaired. That's the legal definition. Colorado, and I believe Washington State enacted a per se law for their marijuana impaired driving. Colorado has a permissible inference law. So we can infer that impairment starts at 5 nanograms per microliter, but the defendant can present contextual information to suggest that that's not the limit, that's not impairment for them. And so the burden is on the law enforcement officer to demonstrate impairment, probably through field sobriety testing. And this, I just want to note, this law applies to minors. So at any age, this is the same law that applies to them. There's not a different law. It's the same law for polydrug use. The White House, Drug Control Strategy, and then other national organizations, Department of Transportation and other groups, support passage of per se laws. And so the debate comes in that some worry that chronic users will be unfairly prosecuted with a per se law. So that, and the argument is, if you're a chronic user, you're going to have this level in your blood, and it's going to be basically a false positive. You're not impaired, but you look like an impaired driver from a blood standpoint. But research is, I think, pointing that this argument's maybe not valid. There's some compelling work from an intramural researcher at NIDA, Marilyn Hustis, who, on one study she did recently, she took 30 chronic users who on average smoked 10 joints a day for the last 10 years and put them on a residential campus at Johns Hopkins and looked at what happens when you have monitored abstinence. And of those, within 24 hours, none had a level above 5. So none of these chronic heavy users would be prosecuted. So I think, we have to weigh the risks of finding false positives. And in reality, drug testing happens an hour or two after after the crash, the driver's pulled over, because first you do field sobriety testing, then you take them to the station, da-da-da-da-da. So, and marijuana is metabolized in an exponential fashion, not a linear fashion like alcohol. And what is the likelihood that individual is going to have a blood level over 5? So, I don't know. That's the commentary portion of the talk. So an expert panel, I have the citation at the end, has recommended that probably the level needs to come down to 3.5. But really, there just needs to be a lot more research, particularly in this blood concentration area of somewhere between 2 and 5 nanograms. And it depends on if you're testing blood or serum, and we need to be clear about that. Apparently there's some confusion in the literature around this issue. And also there needs to be a lot more simulator studies. What happens after a couple hours? How does motor impairment change over time and over longer periods of time? We also have a lot of different laws that have been passed in different states and also nationally or internationally. And so we could evaluate the impacts of those laws on deterrence and those sorts of things. That's a pretty open research area. And definitely we can include improve data collection here in this country and driver education. There have been some evidence-based prevention approaches that have been used with alcohol-impaired driving. deterrence, prevention, mass media campaigns, communication and outreach, and treatment for addicted users. So moving now, this is, I have a couple slides about the future research I'm particularly interested in and would like to get involved in. I'm interested in self-reported use, particularly among young drivers, and the circumstances in which that occurs. Just talking to people in the hallway, I've had more than one person say to me, well, teens who use marijuana, why are they driving? Aren't they just at someone's house? And then this is in contrast, I guess, to alcohol, where you drive to the bar and then you drive home or something. And I think we don't know. We don't know the context, circumstances in which young drivers are choosing to drive impaired or not. I think I would like to study more about the perceptions of harm or perceptions of risk of marijuana-impaired driving, especially in comparison to alcohol, and the social acceptability of those behaviors, social norms around that, the willingness to do that. And then another avenue of research that is really compelling is using simulators and experimental designs to better understand what is the profile of impairment, and to understand the limits of this and just confounders of this. One interesting area, I think, is to look at distraction and multiple tasks. So what does impairment look like when you can have the vehicle to yourself? What does it look like when you put a passenger in there? Or when you have to do a task on your cell phone? How does that change the impact of impaired driving? And looking at tolerance effects, this is a big issue. Medical users or heavy chronic users versus infrequent users. And definitely teasing apart the effect on teen drivers versus adult drivers. And so with that, I have a slide here. These are some safety messages from CDOT that I believe are coming out in a campaign in March, if I understand it correctly. And some references I just think are pretty helpful. So are there any questions or thoughts? Yeah.
As you were going through the slides, I was really thinking about how back when I was in high school, they always talked about not drinking and driving, but there was never any conversation about not driving while high. So I think that's interesting that, however many years later, it still isn't a part of the conversation and there still isn't any research. Do you know why no one's actually started to look into more of the impact? I don't know.
On teens specifically? Part of the issue is marijuana is used less often than alcohol, so it just has a prevalence. And then it's illegal, so I think that affects the kind of the research on it. And then not really understanding what the impact is on driving and what the risks are. And then I think it also leads into this conversation about like all the other drugs kids could be using. We don't know much about any of their impacts on driving. All the illicit, they're still illicit for minors. The impacts of illicit drugs on driving. It's just compared to alcohol, the literature on alcohol is enormous, really documenting effects. And it's also easier because of the chemical nature or the chemistry of alcohol compared to these other drugs.
Impairment and concentration in the brain versus or control for against the levels in the blood or serum?
Yeah. My understanding, and I don't know, I guess I can't point to an exact citation on this. My understanding is the level in the blood does correlate with the level in the brain, but not as strongly as it does with alcohol. And so I don't have a citation I can point you to for that. But when we test, so when we test for the blood level, we don't actually know exactly what the level of impairment in the brain is. And so the issue with other fluids like oral swabs and urine is, my understanding is maybe the the connection there is even weaker, which is why blood is like the closest we have to the gold standard. You shook your head, so I hope you're going to answer her question.
No, you actually answered that question pretty correctly. You're not going to be able to do brain biopsies or things like that. And I don't know if in the fatalities is measured. We know that, certainly THC is lipophilic, meaning it has an attraction for fat cells, and there's a lot of fat cells in the brain. So THC hangs out for long periods of time in the brain as well as in general adipose tissue. But actually, I was raising my hand in response to what Taya had asked. And I think one of the big reasons why alcohol has changed so much is because of MADD, Mothers Against Drunk Driving. And there's obvious core evidence of what alcohol does. And it's been such this gray zone, nebulous. It's not out there well known what the impact of marijuana has. So nobody has taken it on. And I think you need a grassroots group to really do something to mobilize. And it drove me crazy with Amendment 64 because I think the numbers were that about $1.5 to $2 million at least was invested in the pro Amendment 64 campaign, and less than $100,000 was put into the anti-campaign, partly because so much money came from out of state, and then there's just no way to mobilize people around. There hasn't been, at least to this point.
Mm-hmm.
So actually, you showed a slide looking at that there's no differential in penalties for teens with impaired marijuana use.
Mm-hmm.
Is that the same for alcohol? Are the penalties the same?
Oh gosh, I'm not sure in this state. I do think that in some states there's a lower limit of 0.05. Does anyone know about
some states? It's zero tolerance.
Zero tolerance? Yeah.
So I'm really curious as to, first of all, why that would be, especially given the very clear data about increased risk for crashes just by age, right?
Gosh, I don't know. But this reminds me, I wanted to make another commentary about a BAC of 0.08. There's a lot of people who study this that think that's too high. Like, we accept that as like, that's okay. And a lot of people think that that's actually not okay. So it's not the only limit that needs to maybe come down a little bit. I wanted to throw that out there to be fair to alcohol. That people are more impaired than they think they are. Yeah, I don't know. I think, from my understanding, as a transplant, my understanding is that there was this, like, we got to start somewhere, and this political compromise of, where do we start? But yeah, it seems like that's a reasonable place to pick away, is with minors, and maybe with not just minors. Under 21, and then also if you have alcohol and marijuana, the level should not be the same. You also have to say, it's a philosophical question of where do you want to put the burden in the legal system, and this is like way outside my wheelhouse, but what is the burden on the law enforcement to prove what? And then when you take it to court, that's, I think, a very difficult question. But it seems to me at this point, it's going to be very difficult to prosecute someone for marijuana impaired driving. And that what I've heard is that if there's a blood alcohol level, they just stop there because they know how that works in the legal system. And let's not worry about. And that's why there's kind of limited data on what's going on in this state in terms of polydrug use, because, why pursue that avenue when it's kind of murky? Yeah.
Because THC is so lipophilic, does body fat percentage affect blood levels of THC?
My understanding is no. That when they've controlled for, looking at the work of Marilyn Hustis, that less than you'd think, that's not a huge confounder. And I don't know why, but this is something that gets adjusted for and looked at, and yeah.
So not enough to make sure that in the simulation trials you adjust for body fat percentage or anything like that.
We probably still adjust, because if we can adjust for it, we do, right?
Well, but you would have sort of a constant degree grading of THC, which then would be in your blood. So whether it's 3 or 5 or 7, I don't think.
But doing the simulation trials, particularly if you want to look at points in time post-consumption, like that percentage could affect that.
Right. Yeah, it could. It's fairly complicated chemistry, I think, to know. Because then, yeah, I don't know for sure.
New research.
I know. Yeah.
Right.
Just really narrow eligibility requirements for this trial, you know.
And just the other thing, for those of you who clinically work with kids all the time, they are trying to convince us that marijuana makes them better drivers. And I get in arguments, discussions, open-ended discussions with kids all the time about the risks, but absolutely, if they believe in marijuana, they will not accept that argument. And they will sit there and say, by golly, I'm for sure going to go out there, drive under the influence of marijuana, period.
Because they think it doesn't make a difference, or they think it makes them better?
Well, for sure it doesn't make a difference. And the interesting thing is, for those who have ADHD, marijuana probably does make them focus and concentrate better.
This is being recorded.
No, it does. If you talk, that doesn't necessarily translate into better driving performance, but the perception of being able to focus and concentrate does change. So it's such an uphill battle in trying to convince kids that it's not a safe thing.
Yeah, I mean, they don't, so it seems like they don't drive in a way that we would say is aggressive, which is what happens with an alcohol-impaired driver. But if it's taking you a longer time to stop, that's a problem.
Absolutely. It would be great if we could, I know simulators are really expensive, but if there was a way you could get a less expensive simulator and have it in a clinic setting or a public setting or somewhere where kids could just get in it and take the test, I think that would be an
That is
amazing
so
thing.
interesting. I mean, kiosk.
Yeah.
Like ready?
Clinic, you're under the influence because you've gotten your parents' medical marijuana, so it's legal. And then
Yeah.
test.
Just like testing blood pressure. Like, let's just do a quick check-in.
Yeah, exactly.
Absolutely.
Ashley, I think that, the simulated driving really gets us much closer to sort of a definitive look at how impaired and under what conditions, but how in the world with teenage drivings can you get teenage drivers, would you ever be able to get funding, IRB approval, in a really controlled, randomized clinical control kind of way?
Yeah, I think that this program of research will not be able to start with 16-year-olds. I would concede that in this country, even in Colorado. Unless there's like medical users of that age, maybe. I mean, I don't know. Is that getting at your question?
You could use that population for sure, because kids can get medical marijuana licenses. But it's going to be interesting to see what happens with medical marijuana industry, because if you're 21 now, obviously you get it legally, so you don't need a card anymore.
But nevertheless, I mean, you can't maybe do it with 16-year-olds dosing them with marijuana.
Right.
But
Self-report,
they're out there doing it. And so, if you put a whole bunch of kids in the simulator, some of them are...
Yeah, there is the issue of how quickly it degrades. I mean, when the peak impairment occurs. I mean, so I guess you ask them to not drive to the lab, but please step outside and whatever you brought with you, and then please come with. I mean, I don't know. It's complicated. With the kiosk, I like this kiosk. And maybe with that, just.
Mobile kiosk that goes to the prom.
Yeah, I can see this like a van, like an RV that step inside.
It's actually this is an interesting idea.
Yeah. I meant to say at the beginning, I'm also looking for collaborators. So if you want to embark on this journey with me. Barb.
I just wanted to say that the simulator was used to raise teen awareness about seatbelt use. They used to have a traveling simulator, and any high school or middle school
So it's been done before in the field of transportation.
Mm-hmm.
Well, and that relates, I was thinking too, I mean, I wonder if, kids who, or adults who are driving high are more or less likely to wear a seatbelt, more or less likely to use a cell phone, more or less likely to have other passengers in the car, which we know is a huge risk for teen
More likely
drivers.
to eat and drive.
Yeah, right. Eat and drive, which is a source of distraction. Food in the car,
So
reaching
just
for
looking
things.
at some of the behaviors aside from the
Yeah, the self-selection into these groups. Yeah.
Hey, Rebecca, sorry. Just another key message is parents and talking to parents
Yeah.
and talking to adults, because the kids are going to role model after what the adults do. And now there's a whole cohort of adults, obviously, whether it's medical marijuana or legal marijuana, who are driving under the influence and probably don't take that nearly as seriously as alcohol. And so
Yeah.
the parents are getting high and then they're going out to dinner. And if a kid sees that, they're going to mimic that.
Yeah. And that's why, I mean, I don't have any data on this, but I think this issue of who is driving impaired with any age, I mean, we're talking high school students who are reporting this. I don't know. I think that needs a little bit more attention. Parent behaviors and exposing their child to that.
I mean, overall, I think with the legalization of marijuana and just the realization of taking stock of, okay, what do we know about marijuana use in the state? I've just been shocked at how little we know about how many people used it before it was legal. So there's very little that we can do to really understand, like, temporally what's going to happen with this legalization.
Yeah.
On the increase in use.
Yeah.
At least we have some accident data that we can compare that related accidents increase.
Yeah.
And YRBS has been asking marijuana questions for quite some time. In adolescents, but we have nothing for adults.
For marijuana use, there are national substance use surveys, but not so much on impaired driving. Is that, I mean, specifically on that?
Oh, well, no, just I mean the prevalence of, I mean, because we were talking about this the other day. There could be a data set I don't know about, but
Rufus has it.
marijuana use.
There is. There's the National Survey on Drug Use.
Drug use and health.
And they have specifically
SAMHSA.
They provide both national estimates and state estimates, and then sometimes they combine multiple years to provide sub-state levels. And then some of that same type of information is being collected out of the Denver Office of Drug Strategy. So for Denver, we know more about drug use.
And it's pretty reasonable, I think, to think this issue will increase with prevalence, and if prevalence is increasing, then the issue is going to increase. I mean, unless we have like a mad campaign that can go in a different direction than use. Mm-hmm.
Just in comment, the law enforcement, people may have read, I think in January they said that there was only one ticket for driving under the influence of marijuana, but in February 60 tickets were issued or something. So the article was law enforcement's learning how to test, assess for driving under the influence. So they are paying
60
attention.
tickets in the whole state?
I don't know if it was Metro Denver or if it was the whole
That
state.
seems like a really small number.
Yeah.
But it's that testing issue. And can you force somebody who's just in an accident to get a blood test? I don't know the legalities of that. If you haven't caused a fatality, does anybody know more
You can't
specifically?
force people to do a BAC.
Yeah.
Well, you can you do the.
You can't, but you can assess impairment, and per se laws, and there's also laws where if they refuse the test and the police assess them as impaired, they're impaired, even if their level's low.
Yeah, that's the incentive that's in place. If you refuse it, you don't have to take it, but then you're punished as if you test positive. So.
Right, and it's easy to obviously do roadside testing with the breathalyzer, but they don't have that for THC yet, or ever.
And we don't have that kind of data. So the roadside test is just about.
Yeah. Yeah. I think there's a lot of money to be made there for the person who can get to the oral test the fastest.
Well, it'd be interesting. I was in a meeting the other day with someone who had worked in the Netherlands, where
I gather they are a lot farther along in looking at this issue because they've had legal marijuana for a long time. So
Yeah.
it'd be interesting to look. It may all be written in Dutch. I don't know. But it would be interesting to look
Yeah.
at their.
And I mean, there's research internationally, a lot of research out of Australia, which I believe has a zero tolerance per se law, and Sweden also. Yeah. A lot of prevalence data. Well, I guess maybe I'll, close it.
And please join us for refreshments down the hall.
All the way at the end.
And continue the conversation. Thank you.
So when you look at polling,